Muchísimas gracias, señor canciller. Buenos días, soy Carissa Etienne, directora de la OPS. Ahora un cambio de idioma. So, I'm happy to be here with you, and PAHO is happy to be participating in this Iberoamerican Summit. The focus of this year's summit on the three areas are of high importance for health in this region, and certainly for the health and well-being of all of our peoples. Senor Canciller, you mentioned the health ministers meeting, in Ibero-American meeting here in Veracruz that focused on information and communication technologies for innovation. We believe that this is critical for health in our area. Those challenges that face us as a people, as a region, as this Ibero-American space, certainly have impact on the socioeconomic development of our people and their well-being and well into sustainable development agenda. And some of those challenges, and those have been given great emphasis by our ministers in our health meeting. How do we ensure universal access to health? How do we guarantee universal access to health and universal health coverage? And this was deliberated upon and a resolution passed in our last directing council. How do we ensure this access to medicines and to healthcare workers? How do we ensure access to the social determinants of health? Education, the access to education, particularly of girls to education, the access to safe water and sanitation, the access to good housing and healthy food, and adequate food. And this therefore underscores the need of us working together for health in our region. The prevention, detection, identifying, and tracking of communicable diseases. This has come well into focus now with chikungunya in our area, with the resurgence of cholera, and certainly with what is facing us as far as Ebola is concerned. And how do we as a region respond to the global pandemic that is chronic diseases, cancers, diabetes, hypertension, etc., all of those that are with the risk factors of obesity, which there is a pandemic of obesity in many of our countries, and the use of tobacco and the excessive use of alcohol. So how do we respond to those? Also, reducing societal violence, and that has a big implication for health and road traffic accidents, and certainly addressing the unfinished agenda. We spoke about Chagas. Many of the countries in our region are fighting these neglected tropical diseases, while at the same time deciding how are they going to reduce the maternal mortality and child mortality that is so important for our region. We believe that certainly that the increased access to and the optimal use of technologies, including information and communication technologies, are indispensable to improving the health of peoples in this Ibero-American space, but certainly in Latin America, Caribbean, and North America. And particularly if we must do that in a way that is efficacious, efficient, and effective. And this was emphasized by the ministers at the meeting in Veracruz in October. We believe that the effective applications of these technologies can impact health at the individual, the family, the community, and the national level. And so we want to engage with others as far as this is concerned. We can enhance the prediction and modification of social behaviors and impact lifestyles with this innovation. We can increase access to quality healthcare services, emphasizing increasing the problem solving at the first level of care. We can do that with innovation and with technology. We can improve education, tele-education for all our healthcare workers and health professionals if we use tele-education. So, and we can do the early detection, tracking, and reporting and adequate management of many of those communicable diseases which threaten large swaths of our population. And we can improve the timely and effective warning systems for emergencies and future emerging diseases. So we are here today acknowledging the important theme of this meeting, certainly acknowledging the fact that good health of our peoples is dependent on how we use technologies, how we innovate, and how we do this together. So certainly PAHO would like to leave the message that we are committed to working on the declaration of the Ibero-American Ministers of Health, certainly consistent with our resolutions in PAHO, but working with all of you so we can innovate for well-being. Thank you.